Let's begin with the news break coming in on the Union Health Ministry's latest advisory to states. And this is coming at a time when we're seeing the Omicron cases rising across the country. The centre has said to states that we may very well start seeing a stressed healthcare infrastructure soon. The centre has asked states to build makeshift hospitals at the field level to deal with the rising caseload. The government has also asked states to activate district level surveillance. So this is the advisory put out by the centre in its latest letter to the states. They've said that we must ensure that our healthcare system is ready to deal with the surge in cases across the country. Amit Bharadwaj is joining us live with more details on this. Amit, good evening. If you look at the contents of this letter, it's very clear that the centre wants to make sure that the lessons from the second wave is something that we've learned, and we don't see a repeat of that happening this time around. Yes, the severity is lesser this time, but we're not leaving anything to chance.
Absolutely right, and this letter comes at a time, where we are seeing that within a week cases in Delhi, Maharashtra and other states of the country have surged, has seen a sudden surge. And obviously after the New Year festivities, there are possibilities that these numbers could spike yet again. And that is the reason you see that Union Health Ministry is actually is proactive right now and has written letters to the different states, and this letter comes from Rajesh Bhushan, who is the senior health ministry official. And remember, this is the second letter in this week, because the first letter that was sent out to the states, in that letter itself, the Union Health Ministry had asked states to keep a heightened surveillance. And now this particular letter is asking the states to ramp up the healthcare facilities in order to, cater to the patients that might be coming in because of the surge in the COVID-19 numbers. Number two that is to be noted here is that in this particular letter, there is emphasis on refocusing on the surveillance method as well. District authorities has been asked to keep a close eye on the COVID situation in their areas. Along with that, the focus on rural areas has been also mentioned in the letter. So clearly it's a three-step guideline that has been given out to the states. First being that they need to ramp up the medical facilities in their states where the new hospital needs to be opened up, temporary hospital needs to be opened up. Along with that, in case the number surges, the hotels which are in surplus, which might not be operating, that indication has been also made out in the letter that if need be, the hotels should be also roped in. And along with that, this district surveillance has been underlined, and focus on rural areas, because last time around during the second wave, we had seen that the numbers in the rural areas.
Essentially, the focus is on ensuring that, we've learned the lesson from the second wave and all possible preparations are done. Amit, do stay on with us. I also want to focus on how we've seen a massive spike in COVID infections in the last 24 hours. Various states have imposed a variety of restrictions already to curb the spread of COVID. They've banned social gatherings. There are night curfews in effect, especially because of New Year Eve celebrations. We break down the city-wise curbs and restrictions in our next report. The New Year festivities on your screens have nothing to be joyful about. These images are scary thanks to the arrival of a new super mutant variant in the last months of 2021. The centre's appeal to avoid overcrowding has fallen on deaf ears. Despite curbs announced by several states, revelers refuse to fall in line. Social distancing and mask rules thrown to the wind. In the midst of festive fervour, India's Omicron tally has crossed the 1,400 mark. Maharashtra tops the dubious chart with over 450 infections. The Mumbai police brought in strict curbs, prohibiting citizens from visiting beaches, gardens or any other public places from 5 p.m. to 5 a.m. till January 15th. Section 144 has also been extended till January 15th.
Now, the Maharashtra government sources are clearly telling us that if such continuous rise in coronavirus cases happens, then there can be a lockdown situation as well. Continuous monitoring has been done and an appeal is made to people that if only necessary, then only they should leave their home.
The national capital is second on the list with over 350 Omicron cases. The Delhi government issued a yellow alert on the 28th of December. A night curfew has been imposed from 10 p.m. till 5 a.m. Schools, spas and gyms are shut.
With spike in Omicron cases across the country, there has been a spree of vigilance mechanism that is put in place. Despite so, the spike continues. The tally has crossed the 1400 mark. The Delhi government has also asked that any person with fever should be treated as COVID positive. This is the kind of measures that's being taken in place.
And what we know by our data, what is being provided by Delhi government, around 40 to 50% are Omicron, right?
Right.
Now, this is going to be difficult because we all know that Omicron is milder and Delta can be severe. But we need to watch for our symptom. We need to watch for the severe symptom in any given patient.
Tamil Nadu, meanwhile, imposed fresh restrictions in the state till January 31st. There will be no in-person classes for students of grades 1 to 8 till January 10th. Play schools, nursery schools will not be allowed to function. Restaurants, theatres, entertainment and amusement parks will be allowed at half occupancy.
There are a list of restrictions which the state has put till the 10th of January, and it's been said that people need to be more conscious about the entire Omicron as well as COVID situation. It is seen that of the 120 cases that were reported, only 57 of them had international travel, while 63 others have not had any links of international travel.
The situation remains the same in other states too. Curbs have been imposed.
Karnataka recorded 23 new Omicron cases on New Year's Eve. With new cases being recorded, the Karnataka government has strictened restrictions across the state and the city. With all these restrictions in place, the Karnataka government hopes to curb the rise of Omicron cases in the state.
With shoppers overcrowding markets and party lovers refusing to follow COVID-appropriate behaviour, the rise in cases doesn't seem to end anytime soon. Bureau Report, India Today. Let's get your perspective city-wise of what the situation currently is, the rise in cases as well as the restrictions in place. Joining me from Chennai is Akshay Nath. We have Karthik joining us live from Bengaluru, Pankaj Upadhyay getting us all the latest updates from Mumbai, and Amit Bharadwaj joining us from Delhi. Pankaj, I'd like to start with you first. Good evening, a happy new year to you. And it is a happy new year for all of us, but also one where we have to be extremely cautious, keeping in mind the spike of Omicron cases, particularly in cities like Mumbai.
Akshita, very happy new year to you too. And the COVID situation in Mumbai and Maharashtra continues to remain serious because the cases are rising on a daily basis. Chief Minister Uddhav Thackeray today said that the state government was capable of handling the current COVID crisis, but he needs the support of the people. And that if the need be in the days to come, he is going to address the state as well. A clear indication that the state government does not want to impose new restrictions, but if the cases keep on rising and the people do not abide by COVID appropriate behavior, then the government will be left with not many options. At the same time, interestingly, Deputy Chief Minister of Maharashtra, Ajit Pawar, today said that if the cases keep on rising, then more restrictions are going to be imposed. He's already said that 10 ministers and 20 MLAs are already COVID positive. At the same time, I would like to tell the viewers that ACS Health Department yesterday only has issued letters to all the districts of the state saying that they need to be in a state of readiness, be it the ventilator beds, ICU beds, oxygen beds or general beds. There should be no shortage of it. And the deadline has been set. Deadline is that of 15th January, by which time all the districts in Maharashtra need to upgrade their existing infrastructure. The officials also say that Omicron cannot be taken lightly, and the perception that it is transmissible, but then not many need hospitalization is completely untrue, and that people need to take this situation very, very seriously.
That's
officials have gone on to the record of saying that if in the third wave, there are 80 lakh cases, that presuming there's going to be 1% of fatality, imagine there are going to be 80,000 deaths. So the state is gearing up for the worst eventuality, and it has given the deadline of 15th in January to all the districts of the state to upgrade the existing infrastructure.
Let's also bring in Amit Bharadwaj on this. He's joining us live from Delhi. Amit, earlier, just a few days back, the Delhi Chief Minister announced a yellow alert in the national capital. Unfortunately, the positivity rate is climbing up in Delhi. So keeping that in mind, is there a possibility that the alert could be in fact leveled up?
Well, Akshita, we know that the cases in the national capital are increasing and the spike has happened within a week. So earlier what used to happen, or the ideal situation in Delhi would have been that COVID grab was already in force, and with the positivity rate going up with every passing day, the amber alert should have been, or the amber restrictions should have been imposed in the national capital. But that is not going to happen anymore, because now the decisions will be taken in the DDMA meeting, which is the Delhi Disaster Management Authority, and in which the Lieutenant Governor Anil Baijal, Chief Minister Arvind Kejriwal, along with his top ministers like Health Minister Satyen Jain are part. They participate in this meeting. So whether the restrictions in the national capital will be increased or not, whether there will be more curbs, or whether the national capital is moving towards lockdown, all these matters will be discussed in the next DDMA meeting, and then only there will be a decision as to whether the amber restriction should be imposed in the national capital or not.
Okay.
The date for the next DDMA meeting has not been announced yet, but looking at this situation, the way cases are increasing, and especially tomorrow and day after, there could be more spike in the numbers. Possibly the DDMA might regather again, and we could see that there are several restrictions in place. What the sources in the government, Delhi government, are saying right now is that because the hospitalization rate is not going up, that is also one of the reasons that restrictions have not been increased in the national capital.
That's perhaps the only silver lining, the fact that hospitalizations are still under control. There haven't been very severe cases reported yet anywhere in the country. I want to get in Karthik now. He's joining us live from Bengaluru. Karthik, yesterday you were telling us how prohibitory orders like Section 144 were imposed in Bengaluru. Has that been extended beyond New Year's Eve? Is that going to be in place for the next few weeks to ensure that, the spread of Omicron, the spread of COVID is under control?
The night curfew is still in place, and it will continue to be in place.
Karthik, we'll come back to you. We're having a bit of a problem with your audio. We'll reconnect with you there. Meanwhile, I'll take this across to Akshaya. She's joining us live from Chennai. Akshaya, in the city of Chennai also, constant briefings from the government indicate that cases are going up. With, the New Year's Eve, we saw massive restrictions in place in the city of Chennai. Is that something that extends now for the next 1 week or so?
Well, Akshita, we've been seeing that the number of COVID-19 cases have been seeing a constant rise in the state of Tamil Nadu, where we had positivity rate of 0.6 to 0.7. Right now, it's around 1.4% and above. And in the last 24 hours, 1,000 plus new cases of COVID-19 were reported by the state government. And additionally, around 120 Omicron cases were confirmed in the state. But the good news is, of the 120 cases, around 66 of them have already recovered and have headed back to their residences, while the rest of the numbers are still undergoing treatment. And so far, the cases that we've seen in the state of Tamil Nadu, as far as Omicron is concerned, they've all been either asymptomatic or with mild symptoms. But the state health department has been insisting that people should not take this lightly, and should also focus on the factor that only around 53 of them, of the affected people, had international travel history, whereas the rest of them, around 67, did not even have any international travel history. So that is a worrying factor. And going about the restrictions, Akshita, we're seeing that till January 10th, new restrictions have been put into place by the state government. This comes after a high-profile meeting that Chief Minister M.K. Stalin had with most of the senior officials of different departments on the 31st of December. And as far as the restrictions are concerned, most of the places, they've set 50% capacity in entertainment places, in saloons, in gyms, and also schools should not have, offline classes, only online classes for 1st to 8th, and 9th to college onwards, they can have offline classes as per the COVID protocols that are already in place. So new restrictions are there till
Right.
the 10th, and all the existing regulations
And post
will
that,
continue till
perhaps,
January 31st.
post that, we will see fresh curbs being put in place, considering then Pongal festivities will begin as well. Karthik is back with us from Bengaluru. Karthik, back to you.
Well, Akshita, as Bengaluru is concerned, night curfew will continue till January 7th. Now, this was earlier announced by Karnataka Chief Minister Baswaraj Bommai. Now, the Chief Minister is also keeping a close watch on Omicron and COVID cases in the state. Now, if you look at the general COVID-19 cases, they are also on a steep high. As of yesterday, there were around over 800 COVID-19 cases that were recorded in Karnataka. Now, this was just below 500 a week ago. Now, the Karnataka Chief Minister has said that they will be taking precautionary measures like increasing hospital beds, ICU and other precautionary measures to ensure that if Omicron cases or COVID-19 cases increase suddenly, so that the government is well prepared to tackle such a situation. Back to you, Akshita.
All right, Karthik, thank you for those details. Thanks to Amit, Pankaj as well as Akshaya for joining us from their respective cities with the latest updates. The Omicron variant in COVID is raging through Western Europe, and experts in low vaccinated Eastern Europe are anticipating a post-holiday explosion of cases. Vaccine hesitancy in Eastern Europe is posing a great risk amid the super mutant surge.
Coronavirus deaths in Eastern Europe topped 1 million on Thursday as the Omicron variant threatened to batter the region. The figures come from a Reuters tally, which also showed that 3 out of 5 countries reporting the highest number of daily deaths in Europe are from the east. They include Russia, Poland and Ukraine. The tally also shows that although Eastern Europe makes up 39% of the region's population, it has reported more than half the total COVID-related deaths in Europe. Relatively few cases of Omicron have been detected in Eastern Europe compared with Western Europe so far, though, where daily cases have broken records. Poland reported record high numbers of deaths in its 4th wave of the pandemic on Wednesday, though the figure may have been inflated by delayed reporting due to Christmas. Warsaw office worker Marzena Lesniewska believes restrictions should only apply to the unvaccinated.
We need to talk about our society as a whole. It's not just a matter of my own choice. I got vaccinated not just because I want to avoid getting seriously ill, but also in order to limit the transmission of the virus to other people. It's not just my freedom, but the freedom of the whole society that should be taken into consideration.
A spokesperson for the College of Family Physicians in Poland has blamed the rising toll on an overloaded healthcare system, a lack of knowledge and a reluctance to get vaccinated compared to the West, including for the most vulnerable groups. Russia has now overtaken Brazil to have the world's 2nd highest death toll globally from the pandemic. It's now only behind the United States. Data from Russia's State Statistics Service showed on Thursday. The Czech Republic and Hungary top Eastern Europe's vaccination rates. Nearly 64% of both countries' populations have received at least 1 shot. Ukraine has the lowest rate, with nearly 33% of its residents receiving a single dose, according to Our World in data.
And several countries across the world witnessed rather muted New Year festivities, all thanks to the Omicron variant, which has dampened worldwide New Year celebrations. Here's how the world welcomed 2022.
Sydney was among the first to welcome 2022, and while most of the world was forced to scale back New Year's celebrations, Australia's most populous city went full swagger with a spectacular fireworks show that lit up the harbour. It was a rare sight, as splashy displays were called off at Paris's Arc de Triomphe, London's Trafalgar Square, and the Petronas Towers in Kuala Lumpur. New York City still planned for the annual ball drop in Times Square, but with just 15,000 spectators instead of the usual 55,000, masked up, socially distanced, and with proof of vaccination in hand. Still, South Africa, first to raise the alarm about the fast-spreading Omicron variant and now first to declare its Omicron wave had crested, lifted its nighttime curfew just in time for New Year's Eve.
We are all about having a good time. We are all in. all in, yeah?
Other parts of the world did their best to welcome a hopefully healthier 2022. Hong Kong featured fireworks and a concert by the Philharmonic. It was the city's first in-person celebration since 2018 due to both social unrest and the pandemic. And in North Korea, which has not confirmed any COVID cases, thousands masked up to watch a stage show and fireworks in Pyongyang. State media in December reported that the country introduced mask wearing and temperature checks as Omicron spread globally. And while restrictions scrapped most festivities in India, many celebrated in perhaps the most soothing way possible by witnessing the final sunset of 2021.
And you can catch all the latest global updates on COVID and much more on our website, indiatoday.in. Do also download the India Today app. That's all we have time for on this broadcast. Thank you very much for watching.